Well, I have to say, I've had many thousands of guests on the award-winning For the People over the past almost 30 years, but very few of them have been waiting so long to be on the show than all my new friends that I'm making this morning at Recovery Network of Programs. This is a private nonprofit social service agency which has been serving the greater Bridgeport community since 1972, restoring hope, health, and well-being for individuals and families in a recovery environment that embraces compassion, dignity, and respect. And these days, with the additional burdens of COVID, all of that is all the more important. And we're going to hear about all their great work and some of the programs and assistance they might be able to offer you or somebody you love. Jennifer Kolakowski is with us. She's CEO. Moira Rizzo, great to meet you. She's Chief Clinical Officer. Matt Gazzetti's on the line. He's the Department Director at medication-assisted treatment at RNP. And Danielle Levesque is here. She's the Director of Recovery Services. So let's bring it all back to Jennifer Kolakowski, the boss, the CEO. Jennifer, tell us a little bit more about Recovery Network of Programs.
Great. Thank you, John. And thank you. We're so happy for this opportunity, grateful to be speaking with you. So RNP is an amazing organization that serves nearly 3,000 individuals on a daily basis through 24 different programs. We've been serving Fairfield County for nearly 50 years. We're in our 48th year and sort of looking at our 50th year of how to celebrate all of our milestones, accomplishments, and contributions to our community. So how we are organized in terms of the services that we have, and I should say one of the most unique aspects of Recovery Network of Programs is that we do have 24 programs and that we have the ability to pivot and change at a moment's notice when an individual's circumstances changes so that we can provide any number of services. And so we have a number of different housing opportunities for individuals who may need emergency, transitional, or permanent housing. We have 2 residential treatment facilities for individuals who have both a mental health and a substance use disorder. We have 3 different locations for outpatient services, all of which are duly licensed. And in other words, they are able to treat individuals who have both a mental health and substance use disorder.
And where are they?
2 of those 3 locations.
Oh, yeah.
The 2 are they're all in Bridgeport, in various parts of Bridgeport. So we try to make ourselves as accessible as possible.
But your service area is a multi-town.
It is.
Great.
It absolutely is. And some of our programs draw from across the state because we are the only particular provider or provider of that level of care or program. So we do get referrals from across the state.
Great. Well, Jennifer, let me ask you. I'm sorry.
Yep.
Go ahead. No,
sure.
Please finish.
So we also have a detox facility over by Bridgeport Hospital, as well as what Matt will talk a little bit more about, our medication-assisted treatment programs, one of which is in Bridgeport and the other is in Stratford.
Great. Well, we've had a lot of agencies on the program throughout its history, but especially over the past year or so, talking about both providing services or support for folks in recovery. How has the Recovery Network of Programs been pivoting to the opiate epidemic during the pandemic, Jen?
Sure. So we have, we've changed all of our services to make sure that we continue to maintain every level of care despite the pandemic and certainly through the opiate epidemic. And we have been providing medication-assisted treatment for over 35 years. And one of the things that we've done is we've incorporated telehealth services for all of the individuals we're serving. So right now we have essentially a hybrid model of being able to see people in person as well as providing telehealth services. So individuals can have virtual sessions, they can have virtual groups, as well as being available for weekly and sometimes daily check-in calls for the individuals that we're serving and or reaching out to during these very difficult times.
Okay. Moira, you know and I know the cocktail of various types of drugs and additives that folks grappling with addiction have been faced with, especially over the past few years, has been horrific. They're not getting what they're paying for to try to, deal with the pain that they're feeling. But I understand Recovery Network of Programs has a unique overdose prevention and strategy. Can you talk a little bit about that?
Sure. Yeah. I mean, one of the things, we've noticed, we're always tracking, rates of overdose, and certainly through the pandemic, and what we know has been a great mental health crisis for so many people, that the overdoses in the state are exceeding last year's overdose rates for every single month except for August, and still seeing a lot of fentanyl and carfentanil and xylazine, which is an animal tranquilizer, in the overdose opiate data. So, great cause for concern. So, as Jen referenced, because we have so many programs and a continuum of care, I think our biggest strength is that we have this no wrong door. We have so many different touch points to reach people, right? So we have a very active, and Danielle can speak more to this, outreach team who will go to hotspots in the community where we know people have been using or are struggling or have overdoses have taken place. So we're really doing that very proactive outreach to engage people in services, right? We're not just waiting for them to come to us. And then the other thing that we do at every level of care, we are teaching overdose prevention. All of our staff is trained in overdose prevention, which involves a lot, including, the use of Narcan. And all of our clients who go through any of our programs at any level of care have the opportunity to get trained and leave our program with their own Narcan kit, because we know that's, what's saving so many lives.
Yeah. Well, Moira,
yeah.
in speaking about Narcan and the fact that you're seeing, a new generation of additives into the substances that people are inhaling or injecting or otherwise taking in terms of opiates and other drugs, is Narcan remaining sort of the preventative intervention of choice, or are there now new additives that people are consuming and overdosing on that Narcan is not having the desired effect on?
Yeah, well, Narcan, I think, still is the cutting edge, intervention for when someone is overdosing. As you stated, when there's fentanyl involved or carfentanil, which is 100 times stronger than fentanyl, sometimes it will take repeated, administrations of Narcan to reverse the effects of the overdose and, save the person. And I think that's, when you look at the state data, where the overdoses are fatal, it's because those other extra additives that are so strong are involved, and that's when it leads to more fatal overdoses than just the straight opiates themselves, because the Narcan is so effective with opiates.
Great. Folks, if you just joined us getting ready for our music or talk day on our stations, we're with Recovery Network of Programs, serving the greater Bridgeport community since 1972 with the restoration of hope, health, and well-being for individuals and families in a recovery environment. Matt Gazzetti is also on the line with us, along with Danielle Levesque. We'll hear from both of them. Matt, you're the Department Director for Medication-Assisted Treatment. This is a huge component and very successful, I understand. Tell us more about your work and the work that you're delivering to your clients through the Medication-Assisted Treatment Initiative.
Well, we have two programs. We have one in Bridgeport that's called Kinsella Treatment Center, where we serve approximately 800 clients. And then we have another one in Stratford, the Center for Human Services, and we serve close to 900 clients there. We give them methadone to deal with their opioid dependence. And not only do we provide medication for them, but we also provide group, individual therapy, family counseling, psychiatric services. We have added support for clients who have infectious diseases through our Ryan White program. And for any client who's really struggling, we offer intensive outpatient programs at both clinics where a client can come for 3 hours a day, 3 days a week, and also get added individual therapy as needed. And then for anyone who's really struggling, we also have our other programs, our inpatient and our detox, where they can get transferred into those programs. So it's all inclusive within a recovery network of programs. One other thing that we also do is we also have another medicated assisted treatment clinic, and that's actually in Bridgeport Correctional Center. It's called our North Star Recovery Program. And right now we're serving over 50 inmates with methadone or buprenorphine. And by the spring of 2021, we expect to serve up to 100 clients, and we'll also be having Vivitrol as a medication to help deal with opioid dependence. But one of the key things about this program is that we're not only serving the clients while they're incarcerated, we've got an aftercare program where when someone gets released from jail, we're going to continue to work with those clients to make sure that they get treatment outside of jail and continue to get services like housing, job placement, health care, whether it's with us at RMP or anywhere in the state, so that we can help them live successful lives and lower the recidivism rate statewide and keep our communities safe.
And I guess that's where Recovery Network of Programs coaching comes in as a key component to success. Danielle Levesque, Director of Recovery Services, we're going to wrap it up with you. We've got a couple of minutes. Give us a quick eye view into the work you're doing and why this outreach and recovery coaching is such a critical component after the initial contact with the individual seeking recovery.
Thank you, John. It's such a critical component to have people who have been through what you've been through. They're supporting you and guiding you and connecting you to resources, and just there to be that peer level of support. And we just hired our 11th coach. I believe we are the only program in the state that has that many recovery coaches. So it's really important when we're doing outreach for us to identify as people in recovery, which I am myself very grateful to be, and very grateful to be working at RMP, who supports peer support roles more than anyone I have ever really encountered, especially in the state. So I know when I was, going through my struggles, when I was able to have that example of someone who had overcome it, who I knew was in my corner, it made all the difference.
Yeah,
so that's something we really believe in.
Yeah.
That Recovery Network of Programs is providing that, that peer support and that connection to all of our clients.
Yeah, I guess being able to look to an individual who's walked in their shoes really makes all the difference in the world, as well as all of the other myriad offerings that you guys at a Recovery Network of Programs offer, a really, really comprehensive number of services, and we're so pleased to be able to highlight them with the four of you this morning. A Recovery Network of Programs is a private nonprofit social service agency serving the greater Bridgeport community since 1972, restoring hope, health, and well-being for individuals and families in the recovery environment. Our guests this morning were Danielle Levesque, Director of Recovery Services, Matt Gazzetti, the Department Director of Medication-Assisted Treatment, Moira Rizzo, Chief Clinical Officer, and their CEO, Jennifer Kolakowski. Thank you all for this orientation this morning, and we look forward to talking with you folks again. Anyone who is listening who may be grappling with addiction or living with an addiction issue in your household or in your circle of friends, consider giving Recovery Network of Programs a call. Obviously, you've heard the good work they're doing and the likelihood of success. It's recovery-programs.org to check out all of the information you need to engage this organization here in the greater Bridgeport area. Thanks, folks. Have a happy and safe holiday, and we'll talk to you again in the new year.